You're good.
All right, so here we are with my good old buddy, Dr. David Hepburn, and the Buyers Club with a bunch of the staff learning about cannabis. And this is a two-part question we broke up because the issue of cancer is just so huge and in depth. There's so many different angles. And years ago, before CBD came along and we really learned more about it, and patients would come and want to avoid getting intoxicated, we made a product we called Raw, where we basically, do almost a cold infusion, undecarboxylated, where it's THC acid, and we thought and hoped that that would help fight cancer. Are we working in a good direction with that?
So, THCA is the acid form, as you mentioned. That means that when you take THCA and you heat it up or carboxylate it, usually 100 degrees for 30 minutes or whatever, just leave it be. It will sort of degrade into THC. Leave it longer, it degrades into CBN, etc. But THC itself, THCA I should say, is not a very stable compound. It easily falls into the THC area if it's allowed to come under pressure, temperature, and just time. That being said, it is an interesting molecule if you can stabilize it. The most common method of doing that now is the crystalline method for THCAs, but other methods people will swear by. And what's interesting is that it doesn't cross the blood-brain barrier. THCA does not, except the fact that in seizure disorders, which is why it doesn't cause any psychoactivity, THC does and causes psychoactivity. But in seizure disorders, there is likely a change of the whole blood-brain barrier that allows THCA to cross, and in fact is more effective than CBD, probably, for seizure activity, which is remarkable. As you think about CBD, you think of Epidiolex, the first plant cannabis that's been approved by the FDA in America, which is a remarkable watershed moment when that happened in July of last year, 2018. But in fact, yes, the THCA is an interesting molecule. It has anti-inflammatory components to it because it acts on something called TNF. And TNF is tissue necrosis factor, which is synonymous with inflammation. Inflammation is bad when it comes to anything, any condition. We don't get along well with inflammation, especially chronic inflammation, which is responsible for many conditions, cardiovascular conditions and others, cancers included. And I think that what happens is that the effect of THCA on the TNF is quite strong, and it has that anti-inflammatory, has an anti-neoplastic component to it, and of course it has an anti-seizure activity to it. So THCA, I have a lot of experience in it. It's not very easy to keep stabilized in a crystalline form, but the research is becoming interesting. I know of doctors in the States, even in states where THCA is not legal, cannabis is not legal, if that patient, that child is on Epidiolex, which is the seizure medication, to make it work better, they will actually add a little bit of THCA, give it to the patient, or tell the patient to acquire it.
Okay.
Yeah.
Neat.
Yeah, it is. So that's THCA. That was your question, Ted, I think? Or?
Yeah, and so, THC and cancer kind of thing, and along that route, a lot of people, again, trying to avoid some of the psychoactivities of THC itself, would think that they juice and either that may either fight or help prevent cancer. Are they thinking in a good direction?
There are doctors who swear by it. I don't know enough about juicing it as a role in cancer from juicing. I just, pure and simple, don't have that much experience in that field to comment intelligently, so that means I'm going to comment. No, I just don't know.
Good.
Yeah.
So what can you say about cannabis and prevention of cancer? Maybe if someone in your family has a history of cancer, or if you've maybe been recently diagnosed, any information about prevention?
Yeah, so cannabis is a preventative again, I have not seen any data that shows that it can prevent cancer. Very hard study to do, by the way.
Right.
How do you prove that you prevented a cancer necessarily? So there's not the research that it shows that I've seen as preventative. More therapeutic potential is where the research is going into. Again, we know that a lot of problems happen in our body as our ECS begins to crumble as we age. So could that include cancer as well? If cancer is also part of inflammation, as the old saying goes when it comes to cancer, is that the gene loads the gun and the environment pulls the trigger. So you may have genetically predisposed to cancer, but what environment you give that cancer cell, the potential, that gene, is everything, and that includes inflammation, that includes alcohol, and other things that we know expedite that firing of that gun. So that's for sure. It's a very, very good question, for sure.
I have another one too.
Yeah.
So I often think about THC for fighting cancer, and then I also am under the assumption that we use CBD after. Could you talk about some treatment after cancer has been fought?
Yeah, and that, again, I'm not aware specifically. There may well be some research done recently. I haven't seen any that I'm aware of right now that I can comment on. So, okay, well, it surprised me though.
One of the questions that comes up often is about lung cancer. I guess on two fronts. One, does it contribute to it? But on the other hand, we actually have patients that have lung cancer that still come here and use cannabis, and so will that make it worse, make it better?
Yeah, so I mean, this was, will it make it better? Oh, that's a very interesting question, Ted, because people, if they're smoking cannabis, there's other issues related to smoking sometimes. Doctors have a hard time saying smoke this medicine as opposed to vaporize it. They can tend to do that, they have aerosols for asthma and everything else. But to incinerate, smoke, and inhale is not something any doctor would suggest. So as far as cannabis helping cancer, we do know it helps cancer, lung cancer included. But the delivery mechanism, I think, would be important here. We don't advocate the smoking of cannabis for concerns that there may be other things involved, as you know, spliffs, for example, or just itself sometimes the release of products that have been incinerated into the lung.
But the suggestions that cannabis causes lung cancer, can you speak to that for a second?
Cannabis itself, no. Cannabis itself, no, does not cause lung cancer. Delivery mechanisms may contribute, however, and that's what's the important thing. So I've never heard of anybody ingesting cannabis and getting lung cancer.
We got 2 minutes and a question.
So my question is, while treating for cancer with cannabis, is it recommended like a higher THC, low CBD? Because we have people coming in wanting a high CBD, low THC because they can't handle that. But we do recommend the other way. Is there any research on that?
And you're absolutely right. I mean, the fact is that when it comes to, now it depends on the cancer. So, the debate is breast cancer, should it be THC dominant or CBD dominant? Because all medications that are going to be given are going to be either THC dominant, CBD dominant, or a mix. One of those 3 categories and everything in between. Mm-hmm. So, but based on which should be used for what cancer, it's not unimportant to know. For example, one cancer you may want a THC dominant.
Like what?
Medications, well, like say a colon cancer.
Okay.
And the thing is, you're right, you have to ramp up. People don't tolerate it well, or brain tumor. And you have to ramp up in doses that you hope that they can tolerate. And they're pretty hefty doses of THC that normally...
Is it like the Rick Simpson requirement?
Well, it would, I don't know about that per se, but I know that if you're trying to get a patient to, it could be something that is high dose of THC. And I've seen some extremely high doses used for patients to mitigate the cancer itself. Again, hopefully the CBD can take out some of the psychoactivity, normally speaking at lower doses, but you're getting to such high doses when you're getting into hundreds of milligrams of THC
15 seconds.
that it's almost impossible to offset that, so you have to ramp slowly.